Asthma is a chronic disease of lungs. It's a long-term condition in which it becomes harder for air to flow in and out of your air tubes when you breathe. That can be due to constriction of muscles of your air tubes. It makes your airways narrow, air cannot flow freely through constricted airways. In another case, the lining of your airways becomes swollen. Swollen airways don't allow as much air in or out of your lungs. During the asthma attack, it creates more mucus that clogs airways. Asthma affects more than 25 million people in the US currently. This total includes more than 5 million children. Asthma can be life-threatening if you don't get treatment. When your asthma symptoms get progressively worse, it's known as an asthma attack. The symptoms are chest tightness, pain, coughing, shortness of breath, wheezing, difficulty talking, anxiousness, fatigue, rapid breathing, frequent infections, trouble sleeping. What are the causes of asthma? The causes of asthma attack can be those substances that irritate you. These substances are called triggers, like air pollution, dust mites, exercise, mold, pests, pets, tobacco smoke, strong chemicals or smells. What are the treatments? There's currently no cure for asthma, but treatment can help control the symptoms so you're able to live a normal, active life. Eating a healthier diet. Maintaining a moderate weight. Quitting smoking, if you smoke. Exercising regularly. Managing stress. Some commonly used treatments are: bronchodilators work as first aid and quickly relax the tightened muscles around your airways. They can be administered orally or injected. Are most commonly taken with an inhaler nebulizer. Anti-inflammatory medications help reduce swelling and mucus production in your airways, making it easier to breathe.